Yeah, when I first saw the outcome data of the SUCCESS PTA trial, I was really impressed. The SUCCESS PTA trial for the first time gives us confidence that Sirolimus works in patients with peripheral artery disease, having either CLTI or claudication symptomatic. This is an all-comers registry, so we focus on patients from our daily routine work, and having also very challenging patients in our registry. Having seen now these very positive outcome data in 6 months, I'm very confident that Sirolimus plays a major role in the treatment of PAD. So we try to include every patient, so this is a classical all-comers registry. Patients with claudication symptomatics, patients with critical limb ischemia, nearly no exclusion criteria, getting realistic data from our patients who are treated with Sirolimus in our daily routine work. And this, I think, is for the first time a very great registry proving efficacy and safety for Sirolimus in PAD work. I was very happy to see that we included quite a realistic population. So most of the patients, of course, had claudicant symptoms, but we also included 25.8% of patients with critical limb ischemia. And this is the real vulnerable patient cohort we should focus on. The overall length of this patient cohorts was 128 millimeters, so quite realistic. So this is what I call an all-comers registry, focusing also on CLTI patients. So I'm happy to see that we include so many CLTI patients, and the outcome was impressive even in this CLTI cohort. So we focused on the re-intervention rate, analyzing clinical-driven target lesion revascularization. The freedom from CD-TLR overall was 97%. And there was no major difference between the claudicant group and the CLTI group, all around 97%. And this makes a big difference to other studies, especially with paclitaxel. We did not see these great outcomes in these very complex patients, especially CLTI patients. So even these patients with CLTI had a very low re-intervention rate, and I think this makes a difference. When we looked at the technical and procedural success, we could definitely see that we did not find one issue we faced in the past with paclitaxel. We did not see any complication in terms of embolisation. So procedural success, technical success was very high, having no peripheral embolisation. And I think this is one of the main driving factors having these great clinical outcome for these patients. Peripheral embolisation worsens the clinical outcome of the patients. If there is no embolization, the patient will definitely benefit. And this, I think, is the most important aspect we could learn from the SUCCESS trial. The embolization rate was low, and with the efficacy of the Sirolimus, we could definitely help these patients, especially with CLTI and bones. So first of all, it's an 018 platform, so it works very well from a technical point of view. And what is important is, and I already highlight this, there was no washout phenomenon, there was no peripheral embolization with this new technology as we saw it in the past, unfortunately, with the first and second generation paclitaxel device. And with this, we can treat even patients with distal tibial artery disease, so CLTI patient. Good technical procedural outcome is important, no peripheral embolization, and based on this technology, we now have a very good technology available to help these patients.